Okay, everyone. Thanks for coming on today. We're super excited about this. We're super excited to have so many people joining us. I'm going to start talking a little bit about our work with resilience hubs, and then we're going to jump into some um, extreme heat specific information and things that Hennepin County is doing to build their extreme heat response network. So if we could just share the slides, please.
Okay, sharing slides. Um, Folks, my name is Julia Nurbin, and this is Anya Stupor. And I think, Anya, you'll introduce yourself in a second, but you're here because you're part of the Extreme Heat webinar. We're going to be hearing from Jessica Spanwick today, and I'm in the process of putting the slides up. Okay, there we go.
Awesome. Okay. Um, yeah, so my name is Anya Stupar, as Julia said. I am a university student right now at the University of St. Thomas in St. Paul, and super interested in nonprofit work. So I work with MNIPL part-time, and it's been super awesome. So if we could just show the agenda. Yeah, so we're just going to start with our land acknowledgement. I'll talk a little bit about our work with resilience hubs. Then we'll have Jessica Spanwick from Hennepin County talk a little bit about what Hennepin County is doing to prepare for extreme heat and air quality events. As we all know, those have been, I mean, just in the last week, we've been having extremely high temperatures, very smoky days. So she's just going to talk a little bit about what that county specifically has been doing. Then we'll have a little bit of a breakout, just a conversation. So we'll put you guys into some breakout rooms and you can talk to each other about the presentation. And then we'll finish up with some action steps and things that you can do after this if you are interested in continuing to be involved. So I think if Sam is on, if you would please read our land acknowledgement.
Yeah, absolutely. Thanks for asking me to do this. So we like to start every meeting that we do at MNIPL with a land and trauma acknowledgement. So wherever you are, if you would like to close your eyes, put your feet on the ground, whatever feels right for you, I'm just going to read through this acknowledgement. Wherever you may be, let us acknowledge that we are all on Indigenous land. Minnesota is located on the traditional and contemporary homelands of the Anishinaabe and Dakota peoples, the original stewards of this territory. We are committed to uplifting the name of these lands and the community members of these nations as we pursue a right path together. We acknowledge the trauma that is deeply embedded in the foundation of this country. The land we reside on came under the control of the United States of America through genocide, slavery, and ongoing occupation. We recognize the deep historical, spiritual, and personal trauma that has impacted Indigenous communities, communities of color, and immigrant communities. By offering this acknowledgement of trauma, we affirm the right of people to bring their whole selves and stories into this space, and we affirm our intention to promote healing, respect, and love.
Thank you, Sam. Okay, we're going to just start out by talking about MNIPL's work with some resilience hubs. Um, so if we could just go to the next slide, please. We define resilience as the ability of a system to absorb disturbance and still retain its basic function, structure, and feedback. So as we've been moving in these last couple years into really starting to see the effects of climate change, we started to realize that well, we can still continue to do things to reduce greenhouse gases and try to slow the effects of climate change. We're also in the stage at this moment where we're going to start feeling these effects, whether it's in extreme heat periods or more storms, whether it's in the increasing hurricanes that we've been seeing. So, resilience for us is really just about preparing our communities so that we're able to take care of ourselves and our neighbors during these times. And so one way in which we can do this is by building and creating resilience hubs. Next slide, please. So resilience hubs are really just about bringing community together and preparing communities to face these climate disruptions and be able to bounce back and recover from them. So a resilience hub is really just a community center designed to support the community before, during, and after climate-related disasters. So we have three modes, as you can see on the screen here. During our normal time, which is the majority of the time, we're planning for these disruptions. During a disruption, the Resilience Hub is activating and working to keep their neighbors safe and providing support in whatever ways they can. And during recovery periods, the community is working together within the Resilience Hub um, to kind of get back into their normal period and do whatever they need to do in terms of healing and rebuilding. Um, so just a basic chart that we use. So next slide, please. We have when we're working with groups who are wanting to become these emerging resilience hubs, we want to look at these five different areas, five features of a resilience hubs. We want to see how they can operate in both everyday disruption and recovery times. So we have our programs, which can be like services, like a food distribution or childcare. We have our communications, which is just kind of like, okay, how do we communicate on a normal basis? Maybe it's the email list. How is this going to change if there's disruption and the power is down for some reason? We have our operations, which is looking at kind of what personnel are available, who's going to come and unlock the door in case of an emergency. Our building and our landscapes, looking at how accessible is our building space. What types of land do we have green area around our building space that we can maybe plant a garden or something like that. And then we have our power system, looking at can we use more sustainable forms of energy? So solar, geothermal. Can we maybe add some battery backup power so that we can disconnect from the grid in case of a power outage? So that's just kind of the framework we've been using to create and understand these resilience hubs. And next slide, please. What we've created is this program called a community of practice. We ran our first one last year from 2025 to 2026. And this is a group of about 10 emergency hubs or emerging resilience hubs, which are kind of building and learning together and creating their own plans. And our idea is that these emerging hubs will eventually be able to mentor um, the new hubs as we create them. So I just want to talk a little bit about our community of practice from last year because we had a super awesome group. Um, Next slide, please. I have some pictures of some of our meetings together. We ended the year with 7 resilience hub plans. We have 2 of our groups, both in Duluth, who installed batteries. 6 of our 8 groups have either installed solar previously or are in the process of installing solar. We have a couple community gardens on some of our sites, and one of our groups in Minneapolis is currently working to become a cooling center for next summer. So this was a super, super awesome group. We're really excited about them. They did a ton of hard work, and we actually have our application for our next cohort, 2026 to 27, open. So we're hoping to get another great group together and do continue more of this work.
Anya, can I just jump in for 1 second?
Yeah, of course.
I just want to say I just heard back from some of the folks on the ground in Duluth who have been struggling with absolutely record-breakingly poor hazardous air quality due to the wildfires. And one of the big projects that the UUCD in Duluth did during this Resilience Hub community of practice was to think about what would the program look like, the operations, the physical infrastructure, the communication be around a clean air room in their congregation. And of course, they were put to the test much sooner than they hoped. But that's the kind of work that these resilience hubs are doing. They're identifying what are the biggest threats in our particular area and how can we as a community actually make a plan to be ready. So really huge thanks to the folks in Duluth who have been putting their plans in action, and for all the folks in the Twin Cities over the past week that have been doing incredible work welcoming people into their spaces. So I'll hand it back to you.
Yeah, thank you. Um, yeah, so that was just kind of a rundown of our work with resilience hubs. Um, So obviously there's so many different types of emergencies that we can be preparing for, but a big one right now, and I unfortunately in the past couple summers and probably summers to come, has been extreme heat and air quality. So now I'm going to introduce Jessica Spanwicks from Hennepin County. She's the Climate Resilience and Adaptation Program Manager at Hennepin County. She focuses on adaptation, urban heat resilience, nature-based solutions, resilient infrastructure, and equity. We're super excited to have her here and give her a chance to talk to you guys about what Hennepin County is doing to prepare for extreme heat. And while she's talking, I'm just going to put a couple links into the chat of some upcoming opportunities. We have an event next week where we'll be building air filters to prepare for bad air quality days. And we also have an opportunity for people who are more interested in this kind of work to join kind of a interest group. If you're interested in this extreme heat preparedness, we'll be putting together a group of people who are interested who can maybe meet a little bit over the next fall and winter and just talk about how they can get prepared. So I'll be putting those links into the chat during while she's speaking. But yeah, I'm just going to hand it over to Jessica now.
Um,
Thanks, Anya.
Jessica, just
Yeah.
a quick check-in. I have your slides loaded into this slideshow, or
You do? Okay.
would you like me to share them, or would you like to share them?
Let me try because I did make a couple small changes, but Zoom has been very tough for me today. So please let me know if this doesn't work. Can you see the screen?
Yes, we can see it.
Okay. Okay. Please let me know if it malfunctions. Zoom has been crashing on me. Um, but thank you, Julia, and thank you, Anya. My name is Jessica Spanswick. Like Anya said, I'm the Climate Adaptation and Resilience Manager with Hennepin County. I use she, her pronouns, and I'm so excited to be chatting with you today about this very timely topic. So Anya and Julia, let me know. I have about 30 minutes. So I want to go through this as efficiently as I can because I'm really hoping we have time for discussion and reflection. But I'd really like to open with just like setting the stage. What are we talking about when we say extreme heat? And specifically, what is the urban heat island? Because this is a big equity concern. I want to talk about what we're doing in Hennepin County, and I'm hoping that this is applicable to folks all across Minnesota in the region as well. I want to tell you a little bit about the heat vulnerability and heat risk assessment that we've done over the last year, talk about some ways that we can mitigate heat, really launch and talk through with you all what would it look like to create this network of congregations and communities that are prepared to respond to events like the wildfire smoke and extreme heat. I'd like to share some community materials with you that we'll follow up with over email afterwards, and then we can do some of the breakout sessions. Obviously, we are having this discussion today in the midst of an extreme heat wave that, like you mentioned, Julia, happens to also coincide with wildfire smoke that will become much more frequent as we move forward with climate change, unfortunately. So, with heat index already exceeding 100 degrees, our nighttime temperatures haven't been getting below 70, which has a really big impact on our body, especially for people who don't have the opportunity to cool down overnight. Some of you may already be familiar with this concept, but just to level set here, we talk a lot in our space of climate adaptation about the urban heat island. And what are we talking about? We're talking about areas that get much hotter than other areas, particularly during the summer months. The continued rise of temperatures due to climate change and continued development in urban areas will likely make the urban heat island effect much worse over time. What causes urban heat islands? The primary factors contributing to urban heat islands are heat storing materials. So we're talking about dark surfaces that really absorb more energy from the sunlight than lighter, more reflective surfaces. So this absorbed energy is released over time as heat. And many materials that we use for building roads and for building all kinds of infrastructure absorb more heat than our natural landscape, like trees, right? with that, trees and vegetation provide a cooling effect similar to the way that sweating does. So trees and vegetation and soil absorb and release that moisture. And when the water evaporates, of course, it pulls the heat energy from the surroundings, which cools the surrounding air. That's why trees are so important as a solution to extreme heat. We also have tall buildings that can create an urban canyon effect, which blocks wind that would otherwise provide that ventilation and cooling. And then we also have waste heat as well. So densely populated urban areas concentrate heat emitting devices like all of our vehicles, of course, and air conditioners. Air conditioners are so important for our health and keeping us safe. They also, while cooling indoors, emit a lot of heat outdoors, which exacerbates our problem. Now, why do we care about this? One of the big concerns that we have around extreme heat in the urban heat island is our health. So it can contribute obviously to breathing problems like heat exhaustion and heat stroke. It can also lead to birth impacts and even heat mortality, which we'll talk about a little bit later. We're very concerned about our populations that are sensitive to heat, which include babies, pregnant people, our elderly communities, and people who are working outdoors or athletes as well. People who have pre-existing cardiovascular issues or respiratory diseases are particularly vulnerable to heat-related illnesses. Air quality. So heat islands raise energy demand to power air conditioning, which increases power plant emissions that continue to contribute to climate change. So those higher temperatures also accelerate the chemical reaction that produces ground level ozone or smog. Energy usage as well. So heat islands are responsible for 5 to 10% of our summertime electricity demand, which continues to put more pressure on the electricity grid as we need to cool down. And then finally, this is a huge equity concern. Urban heat is not distributed evenly across a neighborhood. I'm going to show you some maps in a little bit where you're going to see that there's a more than 13-degree difference in our nighttime temperatures in July and August in Hennepin County in our urban areas versus our more rural areas because of this urban heat island effect. Now, knowing all of that, we decided to partner up with Ramsey County 2 years ago, and we did a mapping campaign. Some of you may have been a part of this, and if you were, thank you. We had 120 volunteer community scientists who put sensors on their vehicles, and they drove around the eastern part of the county in the morning, in the afternoon, and then again at night to pick up temperature, humidity, time, and location. And we were able to see a pretty drastic urban heat island just in the eastern half. You can kind of see the Mississippi here. This is just the eastern part of Hennepin County, the western part of Ramsey County. So within Hennepin, we saw about a 7-degree difference just in this part of the campaign. I'm going to show you some more data in a little bit here. But after that, we applied for a grant from the Minnesota Pollution Control Agency because we said, you know what, we have this data. What do we do about it? So we said we need to build a Hennepin heat resiliency plan. And so that's what we are just wrapping up right now. So I work in a department called Climate and Resiliency. So we took the lead on this, but we worked with dozens of departments across the county. We built a core planning team that consists of people in public works, our leaders in transportation, emergency management, public health, our libraries, all across the county so that we could look at this holistically. We also built working groups, and I'll show you those agencies, but we worked with over 40 agencies to build a plan and to build strategies to mitigate heat. And then we also worked with community-based organizations. So we worked with Oromo Diaspora Media, Asia Media Access, and the Islamic Civic Society of America to co-build a community survey and a listening session, education materials together. So we worked with over 3,000 residents on this over the last summer and fall. I'm not going to dive too much into the results of that, but I would love to share those with you. We hope to publish all of this online in the next couple of months here. We also did a survey with medical providers within the Hennepin healthcare system to understand the gaps between what medical providers are providing patients. And I'll talk a little bit about that at the end as well. These are some of the agencies who we worked with in 5 different topical areas. So we built working groups in public spaces, housing, public health, emergency response, and occupational health. We wanted to bring these subject matter experts together to say, here's the data. What are you currently doing? How are you thinking about heat? And how can we work together on it? So I'll show some of those results with you here. On the screen, you have 2 maps in front of you. This is all Hennepin County. What we did is we looked at last summer in 2025. So we looked at June, July, and August. And we built out a heat risk assessment where we looked at sensitivity to heat, vulnerability to heat, adaptive capacity. And then we were also using a statistical model able to say that last summer, we estimate that anywhere between 2 and 10 people died from heat-related illnesses just in Hennepin County alone. That is far greater than the official records that you might get from like the medical examiner's office or from emergency departments as it relates to illnesses. And that's because of the way that coding takes place. And that's an issue that we're hoping to get upstream on in this work. But on the left here, this shows you the summer average temperature. So the redder parts here, this is downtown Minneapolis. These are the Brooklyns, Bloomington. You can kind of get a sense for where we are here. As you get bluer, it gets cooler. So this is the average temperature across the county. You can see that we have an extreme urban heat island in our downtown area and in our first ring suburbs, and then it gets a lot cooler in the western part of Hennepin County. On the right, you can see heat-related mortality. Now, some of it does line up. The redder areas are where people are at more at risk of heat-related mortality, and the greener are less at risk. But you can see there's a few anomalies here. We have some red areas interspersed throughout the eastern and southern part of the county, unlike the summer average temperature. And that shows us that risk to heat is also driven by sensitivity, which could be a result of pre-existing conditions. It can be a result of age as well. So that's an important finding of ours. All of this data will be available online. Again, we're hoping in the next couple months here, once we can get the website up, but we would love to share all of this with you. I wanted to just point out a couple data points here. So these are, again, we looked at last summer. Now, these are the average temperatures by month and then the minimum and maximum as well. I really wanted to showcase for you here the minimum temperatures in July and August, because we have nearly a 14-degree difference in our overnight temperatures in July. So those redder parts of the map that you saw over here, and then the blue parts, at night in July, that was an almost 14-degree difference. So that's, I mean, that is a huge equity problem that we want to close that gap, and we want to mitigate the urban heat island. We want to reduce it. We want to eliminate the urban heat island completely, which is why we're doing this work here. So the combination of heat-related mortality and social vulnerability ranked at the block group level is what you're looking at here. And that gives us a comprehensive measure of overall heat vulnerability. So that's reflected of heat exposure, which is temperature, the population sensitivity to high temperatures, which is the heat mortality that we looked at, and then adaptive capacity. So we used the CDC Social Vulnerability Index as a proxy for a community's adaptive capacity to heat. So what you can see here is that overall heat vulnerability is spread throughout the county, but again, concentrated in our more urban areas. And then here, I wanted to share with you, so this is pulling out a little bit from the statistical analysis. This actually comes from satellite data. So from the years of 2016 to 2023, this is the change in tree canopy in Hennepin County. So the redder colors is the more change in terms of reducing tree canopy, and the greener color means that we actually gained tree canopy. So what this is telling you is that in some of the darker red areas, we lost 7% of our tree canopy in just that 7-year period. This can result in nearly a 1 or 2 degree Fahrenheit difference in the ambient temperature. This is a real problem. Now, this tree canopy loss is partially due to emerald ash borer. It's partially due to development of urban areas, but this makes a really big difference, and this is quite alarming. So this is part of what we want to bring forward. So what we did with this is we said, okay, let's model. That was, in the worst parts, a 7-degree decrease. What would it look like if we lost 10%? What would it look like if we lost 10% of our tree canopy in an even worse case scenario? So we call this business as usual, meaning like if we don't do anything, if we stop planting trees and we just let what will happen, what would happen? Well, we would lose up to 10% of our tree canopy. And again, that could result in a 1 to 2 degree increase in temperature in these areas. I'm not going to spend a lot of time on this, but if you're a real data nerd and want to get into the details, I will share all of this with you. But we ran some scenarios to see, well, what would it look like if we gained a lot of tree canopy? What would that do to the temperature? What would that do to our heat mortality? So I'm going to share with you maps of 3 different scenarios. And it's looking at what would happen if we converted 43% of our plantable space in the county to tree canopy. And we would say plantable space, we're not talking about buildings, we're not talking about areas that have lakes or interstates. We're talking about truly areas that could support trees. So what would happen if we converted 43% of that land to tree canopy versus 50% versus 60%? So I'm going to show you the maps next. So this is what it would look like if we converted 43%. We would see a pretty decent cooling, 50% and then 60%. So if we were to get all the way to this 60% of our block groups, excuse me, plantable space converting to tree canopy, that would mean that we would have to work in 88% of our block groups to do that. And we would see really significant cooling. So almost 30% of the block groups within the county would be cooled by 3 degrees Fahrenheit if we were able to reach this amount. There's some block groups that would actually cool by 7 degrees Fahrenheit if we were to plant this many trees across the county. So this is something that we really want to have as a North Star moving forward. I do want to point out, you'll see that we still have higher temperatures in the downtown Minneapolis area here. These are tiny, tiny block groups. So part of this is a result of just the analysis that's done at the block group level. It also is because there's less plantable space in urban areas. So we have to be very creative about planting trees. Now I want to move on and show you some of the high-level objectives and strategies that we came up with as a county with these agencies who participated in the working group process. The first one is emergency preparedness and response. So at a high level, what we decided that we want to commit to doing together is expanding our cooling options and resilience hub networks. And that includes working with you all and working with Minnesota Interfaith Power and Light and with faith-based communities and community centers all across the county. We want to reduce barriers to accessing cooling, expand communication about heat safety, increase heat safety at our events and in our schools. We're also working with EMS and our emergency department providers to provide cooling resources. This has been very, very busy the last week and a half, as you can probably imagine, creating materials and giving them to our emergency providers so that they can respond. In the housing area, some of our objectives are to increase not only awareness of, but usage of things like weatherization and electrification. So air sealing, insulation, getting rid of gas appliances and putting in electric appliances in homes, accessing air conditioning. We want to also plant more trees around multifamily homes and single-family homes as well. We'd like to reduce paving and enhance cooling of sidewalks and in pavement as well. In the occupational health category, we're very concerned about outdoor workers, both in the formal and the informal economy, but we're really interested in protecting workers as they're working outdoors. And there's lots of ways that we can do this. But one of the ways is, like, for example, by promoting work during cooler hours of the day, increasing communication to outdoor workers about workplace safety, et cetera. In the public health sphere, unfortunately, my partner in crime couldn't make it here today, but one of our big partners, and I have some public health folks on the line here too from Hennepin County who are leaders in this space and really spearheading this work. So if any of you would like to come off mute and introduce yourselves and talk, we would love to have you do that. But we're working really closely with Hennepin Healthcare. Dr. Bestagora couldn't be here today, but she's running our public health our medical provider response to this work. And I'm going to share with you a little bit more about some projects we have with her. But we're working on integrating heat preparedness guidance and resources into our existing programs and services, expanding check-ins on heat vulnerable residents during hot days, increasing communication around heat safety. Right now, we're training medical providers to provide heat screenings to vulnerable patients. And then we're also, with the Minnesota Department of Health, building out a dashboard of some syndromic surveillance data to understand where are heat-related illnesses occurring in the county. Does it correlate with things like domestic violence, like certain birth outcomes, like opioid in visits as well. So we're trying to build out a system of data that doesn't yet exist so that we can get ahead of it. And then finally, in the public spaces category, we're really concerned, of course, with building out natural shade through tree canopy, but also built shade where we need to. Some places just can't support trees. So where can we integrate awnings and other creative, built environment infrastructure? Providing cooling at public transit stations and nearby, increasing access to water fountains, reducing air pollution. So these are really high level objectives. We have much more specific strategies within these, but we just wanted to share with you what these look like in these different areas. And there's so many ways that congregations, that faith-based organizations can support in this work. And so we really wanted to have a conversation with you today to kick this off. But before we get into that, I wanted to share with you, we just received another small grant this is Dr. Bestagora, who I was just mentioning here, training some medical providers. This was maybe, I don't know, a few weeks ago at HCMC downtown Minneapolis. So through this grant, we're going to be training at least 40 medical providers to assess patients for heat risk. So when we did this survey with doctors and nurses and pharmacists and EMS, one of the questions was around like, how prepared and educated do you feel as a provider to work with patients on extreme heat and these climate topics? And most people said that they didn't have the proper training or education around this, or resources or time, frankly, to be focusing on this. So that's what we're trying to get ahead of here. So Dr. Stagor has been training family home visiting services, MVNA. These are providers who go into people's homes. So patients who are prenatal or perinatal, patients who are medically homebound, patients who are very vulnerable to heat, and then training those providers. And then those providers are then assessing patients for heat risk and then connecting them to cooling resources. So you can see some of the outcomes that we hope to achieve on the screen here. I'm going to go on here and we'll share all of these links with you after, but if you want to use your cell phone, you're welcome. I have a few QR codes coming up here, but many of you may already be familiar with the Hennepin County Cooling Options Map. So this is a place where residents can go and they can put in their address and they can see where are some places near me that has air conditioning where I would be welcome. Because we know that, we know two things. Some of our community who don't have access to air conditioning choose to stay home even if it gets really hot in their home. So we need solutions in the home. Some people do choose to leave their homes, and we need to have public spaces where people feel comfortable going. And that's where we really want to have this conversation with you all around resilience hubs and cooling options as well. So this is a map that currently exists. We have public health colleagues, please correct me if I'm wrong, but I think we have 288 cooling options on the map currently. It's an amazing system that we have on here. We would like to expand this because we know that there's a lot of gaps as well. And so one thing that we would like to do out of all of this is to build the Hennepin Heat Relief Network. And again, we'll share these links with you, but Maricopa County in Arizona has a beautiful system where they've created, these are screenshots from their system. They have 4 different areas where churches, mosques, synagogues, fast food restaurants, community centers can apply to be listed on their site as a respite center. So this is an option that is indoor, it's air conditioned, it offers hydration, and it allows for somebody to go inside to cool off, to sit down, to lie down during their hours of operation. That's one option. Another one is a cooling center, and this can be an indoor air conditioned location that offers hydration, like a library, for example. We have all of our libraries are on the cooling options list. Another option is a hydration station, which could be indoor or outdoor, where individuals can go to receive water and collect donated items. And then another option is a collection and donation site, which is where water bottles could be donated and different types of beat the heat kits, for example, could be provided. For example, we've experimented with giving residents cooling towels that you put cool water on and you put it around your neck, or it could include the little personal fans that cool you down, or electrolytes. There's all kinds of supplies that could be included in this. So this is our vision of getting to this point. We're not there yet, and we don't have the infrastructure yet in place, but our goal is to have an application system where organizations and communities like yours could apply to be one of these. And to really show up for your community the way that you already are, but in a systemic way that you could be listed on the website. I want to share with you a few different materials that we have available for you. So we don't yet have a place where you can just click this on our website and download it. So I would have to email it to you, but I would love to email with you some PDFs that we've created that can be printed and shared with community. So one is here about how do we stay safe in the heat and humidity? One, we stay hydrated. These are things that we know. We drink water. We replace salt and minerals that we've lost. We stay cool. We take breaks in air conditioning. We wear lightweight clothing and light colored clothing. We avoid, excessive exercise during the hottest parts of the day. And then some ways that we can prevent heat illness as well. Hennepin County has a lot of these materials. So does the Minnesota Department of Health. They've got a lot of materials out there as well. Check in on our neighbors who are elderly, who don't have air conditioning, who live alone. Those are populations who are very susceptible to heat-related illnesses. So this is one flyer that we have. Another one here is on home cooling. So how do we keep, again, I mentioned a lot on our survey, we found that most of our residents choose to stay home, even if they don't have air conditioning. Most residents choose to stay home rather than going somewhere else. So how do we keep people safe indoors? One is fans can be a very effective way to cool our space, but up to a point. The Minnesota Department of Health says maximum 95 degrees. Once it gets above 95 degrees, it's not safe to have a fan running without cool air. We can ventilate strategically. We can block our sunlight. And then there was also some tips here on, safety when we don't have any power as well. Personal cooling, here are some more tips that we have around this. So cold water cooling, I mentioned those cooling towels that we have. We can also use cold water or ice. We can shower. We can place them on different parts of our body, in our armpits, on our feet, all over our body. We can dress for the heat. We often don't think about eating for heat as well. So not only drinking water, but eating water-rich foods like vegetables and fruits, avoiding things like coffee and teas, eating smaller, more frequent meals can also help our body be resilient to the heat, and avoiding heavy and fried foods as well. And then there's also some tips here around heat healthy changes. So these are some materials that we have available we can share with you. And then I want to just end by mentioning, what are some things that we can do right now as individuals or as communities in your congregations and your communities? A couple things. So these QR codes will take you to the Air Now app. Many of you might have already have this downloaded from the last few summers here in Minnesota. But this app will tell you the air quality index and give you an idea of what you should do based on the level that it's at. You can also download the Heat Index app through OSHA and NIOSH. This one's really great because it gives you the forecast, and it also gives you symptoms of heat-related illnesses as well. And then finally, I want to mention Be a Buddy. Some of you may be familiar with the New York City Be a Buddy program. This is something that we would aspire to really build programmatically someday, but it's something that all of us can do in our everyday lives. And it's checking in on people. It's checking in on our neighbors who live alone, who are elderly, who don't have air conditioning, and seeing how they're doing and getting them to a safe place if they need it. So with that, I've talked a ton, so I would like to stop talking and thank you all so much for listening. Would love to share all this data with you. I saw a couple chats come in, so I will stop sharing my screen and take a peek at that. But I'll pass it back over to you, Anya and Julia.
Julia, I think you might be muted.
Oh, there it is. I just wanted to say thank you, Jessica. What an incredibly rich set of slides and information, and what an incredible program that you are building in Hennepin County. We are really lucky to live here and to have access to these resources. Anya, I want to just say a couple of words about what Minnesota Interfaith Power and Light is doing with Hennepin County right now, because I think that it would be useful for people to know that. And then I think we'll move into the breakout and into the action steps. If you all have questions for, um, by the way, we will set out the presentation. We'll also send out the link so that you can watch it again if you have other people you'd like to watch it with. So you'll have all of those resources after the presentation is finished. But here's a little sketch about what MNIPL is doing with Hennepin County. So we had an opportunity to apply for some money through a program called Fortify that Hennepin County runs. And what we have done is connected our Resilience Hub program that Anya has talked about with the efforts that Hennepin County is doing to address heat. And we're producing this event, of course. We also have an event next week on air quality. So hopefully you all have seen that link in the chat, and Anya, maybe you can put it there again. We would love to help teach you all how to make filters, air quality filters with fans and basic air filters for furnaces. But we are going to be, we have a group of about 5 congregations who are going to be working with us to go and experience a tabletop scenario. What would happen if the temperature got to be 105 degrees for 5 days in a row and the power went out? We're going to be working with the folks out in Medina and the emergency response folks in Hennepin County in order to figure out how each of our communities or our emerging hubs would respond to that heat emergency. If there are any folks out there who would like to participate, this is not a strict rule. I can see a lot of our Resilience Hub partners on the screen right now. But if there are communities that were not part of our community of practice in the last year who are interested in participating in this extreme heat exercise, we'd love to hear from you and figure out if there's a fit there. At this point, it's sort of invitation only, but we are open to working with other communities that are particularly interested in becoming heat ready cooling centers. So I'll hand it back to you, Anya, and I'll put these slides back on the screen.
Perfect. Thanks, Julia. And thank you, Jessica. That was a really enlightening presentation. We're just going to take some time to discuss this breakout question I have for you guys. So I want you guys to imagine that, like Julia was saying, an extreme heat event is taking place. Oh,
I'm sorry, I'm gonna put that back on the screen. I think I can't do the breakout rooms and share the slides at the same time, so I'm gonna
got it.
so why don't you continue to just describe it and then we will.
Yeah, I will just put our questions into the chat for everyone. So here's our prompt. So imagine an extreme heat event is taking place. How do you envision an institution you're connected to being part of a response network? So this could be your place of work, your place of worship, a community space. What barriers or bridges might this institution face? So what things do you have going for you? What challenges might you experience? And then this is a question that Hennepin County is really interested in. What physical supplies might be helpful to support your community? So what physical supplies maybe could the county provide, like N95 masks during an air quality event or cooling towels or things like that? So we're going to put you into breakout rooms, I think maybe for like about 5 minutes, just to talk about this question. And then we'll bring everyone back and um, put out some answers into the chat and see what everyone talked about. So I think hopefully we can send people out in groups of 5 shortly here.
Here we go. All right. You will
Awesome.
be asked to join your room, so go ahead and join. All right, welcome back. Welcome back. So we would love to hear from you about what some of the emerging ideas or things that bubbled up as you were having your conversation about barriers and bridges to what it would look like to have your institutions involved.
You guys can go ahead and put things in the chat or raise your hand. Suzanne, I see you.
Yeah, I figured I could pipe up with what we were talking about, which is
Yeah.
how do we help these small organizations, like little tiny places who don't necessarily have lots of staff, but we have freezer space. Is there some way we can get these excess freezer, cooling packs and information out to our people? Is there also some way we can band together with the other counties so that like my congregation has a solar panel already, but we don't have a battery backup. The other group that was in here was also talking about can they get solar? Can they get a battery backup? Where do we get the grants? Because we're so small that it's hard for us to do the all the grant searching.
Oh my God, Suzanne, first of all, thank you for saying so much of what is on my mind and in my heart on a regular basis. But what to me, as I hear you talk, it makes me think about, what are the ways in which we can really be effectively networking, in which we don't all have to be part of the same institution in order to be able to support each other in those critical moments. Um, and I will invite you formally to think about whether maybe there's a core team um, over in Ramsey County. You're part of Ramsey County, is that correct?
Dakota.
Dakota. Um, uh, Even better, if you were interested in being part of the community of practice, what you have just asked is like the center of what we try to work on together.
Oh yeah. Yeah. I mean, I think our little see, there's two things that I work on. One, I have a little church I'm working with. The second thing is I also work for Alina Health. And I
Mhm.
know that we have pharmacies that have ice packs that they're throwing away because they don't have anyone to take them. So there's got to be some way. And the gal from Hennepin County was just saying that they do too. And is there some way we can connect these things? Is there some way we can get this in? I mean, even cooling rags and ice packs out to our clinics all over the place. We're working with one of the healthcare organizations, but not the other ones. And we're also not connecting with our climate action plans that we are actually having on the healthcare organizations, then, and probably our churches too, but they're not connected yet.
Totally. Networks, maps. We have so much work to do. Amazing.
I see a comment in the chat about potentially partnering with city staff, Red Cross, to address staffing and capacity issues, which is great. We would love the ice packs. Yeah, if you guys are interested in ice packs, Jessica has her just put her email in the chat. I'll also be sharing that at the end of this presentation.
What else was bubbling up for you all? We'll just take one more.
Sharon talked about her church is now recognized by the Red Cross as a heat preparedness facility, right, Sharon?
Oh, we can't hear you, Sharon.
No, I think they're two totally separate things because ours is through the Red Cross is for a space for when there's a hazard or something happening. We're a safe place and stuff, but it's totally different, I think, than what these hubs are for the heat, which I want to find out more about to see if we can also become part of that too.
Amazing. Well, we really would love to talk more with you about the community of practice. But I will say that, there are so many efforts that have bubbled up, and they have different names and they have different certification programs. And if we can figure out how to put these things under one tent, maybe not controlled by one entity, but in a way that a small organization or a small congregation can have access to a variety of resources, I think it's going to be very powerful. I love the question about, or the thought about using outdoor spaces connected to the building. And I want to notice that, one critical barrier to institutional efforts to try to help in either heat or air quality events is this question of who is going to be the person to unlock the door. So it makes you realize that you can't just have a space. You also have to have an operations plan. And in some cases, it may be that we can't be letting people into our building. It's not safe, it's not well managed, but we do have all sorts of outdoor spaces. And what would that look like? So this sort of illustrates that really, in order to plan for summer 2027, there's going to be some meetings that need to happen over the next 9 months in order to be ready to figure out, can you open your door or not? Where are the hoses? Who might be able to use them? How do we communicate to people in the neighborhood that that's something that they are welcome to and not sort of forbidden from? All of those questions are swimming. So now I want to hand it back to you, Anya, so that you can wrap us up, and I will put the slides back up.
Awesome. Thanks, Julia. Yeah, I can see we're losing a couple people. So really quickly before people head out, I just want to go over some action steps. I mentioned them a little bit before in the presentation. I'm going to have some QR codes up for you guys. We'll also be sending links, so don't feel like you need to rush and scan the QR codes now. If this presentation interested you, if you're interested about how you as an individual or an organization can get more involved in preparing for extreme heat, this is just an interest form, basically saying, I'm interested in how I can help and how I can be a part of this network. There's no commitment. It's just saying that you want to learn more. So we're going to send this link out. Next action step, next slide, is our next week. We're going to be having an air quality event. So there will be, it will be in person on July 29th, I think Wednesday. We'll be having pizza and you'll be learning how to create an air filter. So if you register now, you'll be able to get your own materials so that you can create your own air filter and bring it home with you. I think that's it for that event. We're super excited about that event. And then finally, our community of practice for 2026, 27. So some of you guys were saying you were interested in that. If you scan this QR code here, it'll take you to our application. On our application, we are also listing our kind of goals and our overview so you can read a little bit more about it before you apply. Applying is no like commitment to participating. So if you are interested, if your organization is interested, just yes, I will put the link in the chat in just a minute here. Definitely just send us an application. And
Well, we'll follow up with you. We'll do a site visit and sort of talk through what your goals are and how it would be useful and who you'd want to participate. So there's a sort of a next step after the application.
I just put that link for the application in the chat. And then our final slide here is just a couple emails. You have my email on there. You have Jessica's from Hennepin County. Also, our Beth Grace, who's kind of our lead in the Resilience Hub community of practice areas. So you can send any questions about that to me, but if you have questions, more questions, specific questions about Resilience Hubs, Beth is also a great person to contact. Yeah, I see that's 1 o'clock. So I just want to wrap things up. Thank you all for being here. This is really great. I'm glad we got so many people here. We'll be sending out a follow-up email, giving you guys links to everything we talked about. And yeah, thank you for coming. We hope to see you next week at our air quality workshop.
Thank you.
Bye, everyone.